view it as in a sense, a wartime president. I mean, that's what we're fighting. We will be invoking the Defense Production Act. We're sending, upon request, the 2 hospital ships. They're being prepared right now. They're massive ships.
I have directed, as the president mentioned, that the hospital ships Mercy and Comfort be prepared to deploy to increase the nation's medical capacity. And we have also alerted a variety of field and expeditionary hospitals to be prepared to deploy as well as needed.
Defense Secretary on our show last night talking about the deployment of U.S. military assets to fight this, as the president called, invisible enemy. Taking a look at the numbers now, the coronavirus in the U.S., all 50 states, total number of cases 7,663, total deaths 115. Worldwide, more than 214,000, 8,700 deaths, but total recovered at this point, 83,313. The Dow taking a big dive today and then recovering a bit. The Senate obviously moving forward with the House bill, the Phase 2. If you look at the Dow, just one market obviously, but the Dow Jones, since the president's election, take a look at that rise and then that dramatic fall when the coronavirus hit. Let's bring in our panel. Charles Hurt, opinion editor for The Washington Times, Mara Liasson, national political correspondent of National Public Radio, and Steve Hayes, editor of The Dispatch. Steve, we're looking at all that the federal government is doing. We've obviously seen this second phase, the bill heading to the president's desk, and it seems like more is on the way, significant amount more.
Yeah, look, I think it's an encouraging development that you heard the president describe himself as a wartime president, because I think that's what we need from the White House and from the administration in order to make up for some lost time. You need the federal government scrambling, I think, in some ways to catch up to the states, and the kinds of measures that we are now seeing the federal government taking, whether it's moving the military ships to places that could be a good outcome. I mean, at least we're preparing. I'd like to see them now move on ventilators, move on additional protective gear for physicians, healthcare workers, and other things to really make sure that the people who are on the front lines of this are protected as they try to take this on.
Mara, I mean, we should get our heads around the fact that these numbers are going to just exponentially go
explode
up as this testing goes into place in big numbers.
Yeah, and the administration has been trying to prepare people for that. I mean, we've been flying blind. Unlike some other countries, we didn't test massively in the last 2 months since it arrived on our shores. So people are going to get tested, and we're going to find out, hopefully, how widespread this is. And it's going to be a shock. On the other hand, once we know who has it, it's going to make social distancing more targeted. At least we'll have the ability to do that. I mean, that's what they were able to do in South Korea and in Singapore. But yes, we're going to have a big explosion, and then it will also make the fatality rate get smaller, because we're going to understand how many people have it and how many people are dying. But in terms of the response, I think you're going to see this rolling response. Today it was all about paid sick leave, free testing. Next, it's going to be about actual cash in people's pockets.
Yeah, and just to put that up, Charlie, in Phase 2, expands paid sick leave and family leave to those in quarantine or caring for a family member with the illness, offers free coronavirus testing for those without health insurance, extends unemployment insurance, boosts food assistance, provides school meals for children whose schools have closed, and provides additional federal funding for Medicaid. But we're ready for Phase 3, as Mara mentions, and that's really just a check to all Americans. You know, Andrew Yang left the race a month ago, and he's saying, man, there's my $1,000 a month. My idea may actually come to pass. We don't know the numbers yet.
Yeah, it really is kind of amazing when you look around and you see these orders coming from governments to shut down restaurants, to shut down gathering places of 10 people or more, coming at the state level or local levels. It's kind of amazing. Those people obviously are that work in those environments are going to be the ones that are going to be the hardest hit, and that's going to be, and that's a very real thing. This whole time we've sort of been in this waiting game, and it's hard to do, because most of the stories that we read about are stories about effects of quarantines and effects of things that have taken, the steps that were taken as sort of precautionary measures, as opposed to actual results of the actual virus. And this is particularly true outside of places like New York and Washington and rural parts of the country, and where you see that great report that we just had about people purchasing guns and ammunition. What that is, more than anything, it's a very healthy American indication that people trust themselves to take care of themselves and their neighbors more than they trust governments, whether they're the local government or the federal government. I think the important thing at this point, wherever you are on your level of concern about this, is it's kind of like the saying, if you find yourself walking through hell, don't stop. And I think Mara is exactly right. Anything that we do at this point, wherever you are on the concern scale, whatever you can do at this point to keep going, to march through the bear market, to march through this stuff is a good thing.
What we were talking about, not going to places with 10 people or more, obviously Capitol Hill has a few more than 10 people. Yeah. Just getting word right now that Congressman Mario Diaz-Balart has tested positive for coronavirus. After voting on Friday, March 13th, he self-quarantined, not going back to South Florida with his wife, but just passing that along. Something tells me we'll get a lot more of these positives as the tests continue. Panel, thank you very much.